Hi guys, my name is Nathan Hughes and welcome to my video diary. I'm going to be talking about my Intralase wavefront laser eye surgery today. So I'm having my surgery done in a clinic called Intralase in Belfast City Centre today. I am a bit apprehensive about it, but what I'm intending on doing is showing you the procedure of how the surgery is done, the tests that happened beforehand, my reaction to the surgery, and the following few days and weeks after the surgery and how I recover. Okay, so I hope you enjoy it. So I've just come out of my consultation with the surgeon. I'm wearing a stupid hat now because I'm about to go in for my surgery. After having spoken to Wayne, the surgeon, I do feel a lot more confident now, but the surgery is very experienced. He talked to me about the after effects of the surgery and how I'll feel this evening. The staff have been really nice so far, and I also got to meet someone who'd just come out of their surgery, and he said there was no pain, it was very quick, and all I could see was a little bit of bloodshot around his eyes, and that was it. If you look up here, you can see the actual surgeries in use at the moment. The laser's being used on someone. So I'm going to quickly show you me inside, but I can't record the actual surgery itself, and then you'll meet me afterwards when I've got full HD vision.
Yeah, stop just there, that's perfect.
Nathan B. 7 to the first 87.
Perfect. You're having a wavefront Intralase procedure.
Yeah.
You're having that both eyes.
Yeah.
Any allergies that we should do? It's a great look, it's just the look that you want on the camera.
Bending, it's not acidic into your eyes.
Yeah.
And on your eyes. Just close that, stay a little bit. And you're ready, just open your eye. Set behind you. Keep both eyes closed now, so the previous support drop just to clean the eye, just look behind you. Like stay with this close. And the other side. Close. Okay, so just let the surgeon know now you're ready, and then we can get started. Just keep your eyes closed if they're stinging. It just takes a few minutes for that to wear off. That's it. Just gently close your eyes, try not to squeeze them shut.
Okay.
Thank you very much.
See you now, alright?
I'm just going to take you through and check.
Could I have to just be discharged? So
Okay.
I just want to go through here.
No problem.
I've just come out of the surgery. The whole thing was a bit daunting. I'm actually shaking now. I think it's just the adrenaline. I feel totally fine now. There's no pain. There's anaesthetic drops in my eyes. I'm just a bit sensitive to light. The surgeon's just seen me there. But I'm just about to be discharged here, so I'll speak to you later, okay? They're probably a bit bloodshot. Can't actually keep my eyes open, it's too sensitive to light.
If you go one more time, just
Can you see my eyes?
that's it, cool, yeah. Gonna focus in, yeah. That's you, yeah.
Straight after the surgery, I sat up. I felt a bit nauseous, had a sore head, but was fine. Was able to walk past, and then it took about 15 minutes before the pain started kicking in, which apparently I'm going to experience now for about 4 hours. It does feel like you've either got soap in your eye or you've got like an onion has made your eyes cry, and it's consistent. What I suggest they do in future is that they allow you to take the diazepam at least half an hour before your surgery, so you're properly calm. The surgery itself, the only weird thing is the cutting of the cornea, where they stick like a suction cup in your eye. You do feel pressure. It's a really, really weird feeling. And you want to get away from it, but you can't. Then you have to continually look at
a laser for when they're doing the laser part, and it's very hard to keep the other eye open as you're staring at that laser, because they've covered one eye. It's very hard to know that the other eye is open. Alright, it's not that bad, but the initial shock of it has sort of made me get anxious and shaky. So, cheers, Cocodamol.
Okay, good morning everyone. It's the morning after the surgery, and I'm just letting you have a look at how my eyes are looking at the moment. I'll try and get a little bit closer, and it does look a bit crazy. I actually slept quite well last night. That's the other eye there. And this morning I've woken up with no pain whatsoever. I just have this like bruising around the eye. Just touch it. I had to sleep with goggles on, which really helped. Actually, they were quite comfortable. And I'm about to go down and get my eyes checked and Intralase just to make sure everything's okay. ENZL.
And the bottom one.
The bottom line, EFFN.
Good. Okay, that's really take that was your level of vision before treatment.
I could have seen that before.
Just about no more.
Oh really?
Yeah. So that's
Now I can read that.
that's before treatment, and then so that's before, and then that's after. Don't rub or touch your eyes, and the drops regime, and lubricate the eyes, that kind of thing. And we'll see you in a week.
Okay.
Alright.
Thank
You
you very
happy
much.
enough to come in next week, Nathan? Yeah.
Yeah. So it's now 2 days after the surgery, and this is the first time that I've actually been able to see the snow without my glasses or contact lenses. To be honest, it is pretty amazing. Have a wee look outside here. Okay, we're now on day 4 of my recovery process from Intralase LASIK eye surgery. What I've noticed is that although I woke up the next day from the surgery being able to see a lot better than I could when I didn't wear glasses, my vision is covered by like a mist or a haze, and I still am getting like halos around images, especially in artificial light. It's actually it makes my eyes go very sensitive, and the focus in my eyes can be difficult if I'm looking at bright images or things in the distance in artificial light. Now, hopefully that is something that's just part of the recovery process. I don't know. I've been putting my drops in. I've noticed my eyes are still pretty bloodshot. You can probably see. I've been sleeping with my goggles on. I've been following all my instructions. So hopefully that clears up, and I do have an appointment on Wednesday to see the optometrist, and hopefully I can clear things up with him then. Been 5 months since my laser eye surgery, and I just wanted to give you an update as to how I'm feeling and how I've recovered since the day of the original surgery. All in all, I am now seeing a 20/20, which is great. I've had my eyes independently assessed. The only downside is that apparently I have damage to the inner part of my cornea. My optician called it central corneal stromal inflammatory cells, which are non-active, and the non-active part means that it's not going to get any worse. The scarring has healed, and it's permanently in the inner part of my cornea, it's not on the surface of my cornea. So he said that whilst it's not probably going to get any better, it's not going to get any worse. And the only way that that really affects me is that when I'm seeing at night time, there is definite starbursts and very obvious blurring around white light, especially if I'm in like a dark cinema or a dark room watching the television, which can be quite annoying for my work. So again, yeah, I would definitely have reconsidered had I known the overall effects of the surgery prior to having it done. I would have considered whether I could have actually seen better with contact lenses, which I could have. But yes, I am seeing at 20/20, but it's how I see the images. It's how around the edges of the images are blurred, or my vision can be cloudy at times as well. In some ways I'm glad I've had the surgery done. I don't have to put lenses in at night time, I don't have to take them out in the morning, or sorry, vice versa. But for convenience sake, yes, I can wake up and I can see. But all in all, I just don't know how good a job was done on my eyes. Maybe it was a particular clinic that I went to, I don't know, or maybe it's just that it's just a rare thing that's happened to me. But just consider your options before you definitely go for laser eye surgery, because these risks can happen, however minor they can happen. But thank you for watching my video, I appreciate it. Feel free to leave any comments and I will get back to you.